Welcome to Invisible Bias when AI sees what we can't. I'm Angelica, a neuroscience and cognitive science student and researcher passionate about ethical technology in healthcare. And today we're going to dive into how does hidden bias in AI model lead to real differences in how neurological disorders are diagnosed and treated. Please, let's just imagine this for a moment. A hospital in the US brings in a new AI system to help doctors spot brain conditions using MRI scans. Two patients walk in with early signs of Alzheimer's, one black and one white, with very similar symptoms. The AI quickly flags the white patient for immediate follow up. But what about the black patient? No alerts. Turns out the AI model was mostly trained on data from white patients. So the system wasn't broken. It was doing exactly what it was trained to do. That's the scary part. That oversight meant the black patient's diagnosis was delayed by a whole year. This isn't science fiction, folks. It's happening right now. One of the most shocking findings from recent research is that AI models can detect race from medical images, even when doctors can't. According to a 2019 science study by Dr. Seat Overmeyer and his team at UC Berkeley, an algorithm used in US hospitals prioritized white patients over black ones, not based on need, but because of the biased historical data. Let's break that down. The team explained that health needs were projected using healthcare costs. Since Black patients often received less care, the model assumed they were healthier. So, what does this mean? If AI learns from biased data, it can worsen existing inequities. In brain medicine, that could mean missed strokes or delayed diagnosis in patients of color. I cannot stress enough the fact that bias in AI isn't just about a malicious intent, it's often about missing data. Parker and Rickard at the University of Montreal said, neuroimaging data underrepresents Black, Latino, and Indigenous populations. Now let's think about it. An AI trained mostly on white male scans may miss symptoms in women, black patients, or elderly people. These aren't just technical issues, they are ethical failures. As Dr. Gina Wins and her team at the University of Michigan wrote in Nature Medicine, AI must be evaluated not just on performance, but equity. You may think, but AI is just data. Neutral, right? Not really. In science, Overmeyer's group showed that using costs as a proxy for illness led to underestimated risk for Black patients. Some people say AI will improve over time, but Wins and colleagues warned without intervention, machine learning systems will likely amplify inequities. So, we must change what AI learns from and audit these systems before they cause more harm. So, what we can do? First, require data checks. Every AI system should show its training data breakdown, as Win said. Without transparency, there can be no fairness. Second, use inclusive design. Build fairness into development from the very start of the AI. And third, lawmakers must require bias audits before AI approval, just like safety tests. And here's the big picture. When data lacks representation, AI fails those most at risk. Thank you very much for listening to Invisible Bias. And remember, bias only stays invisible when we stop looking for it. Until next time, stay curious and keep asking thought questions.